Thank you for joining us to talk about silver diamine fluoride. I'm Sarah French, and joining me here today is my partner, Natalie Lobo. We are completing this as our research project for DNH 244, and it is the fall 2020. As I mentioned, our project is based around silver diamine fluoride. We picked this image because we liked the dramatic, this changes everything. Silver diamine fluoride is typically and traditionally a clear liquid, and it's like other fluorides in that it can treat dental hypersensitivity, but its most promising use is currently off-label for caries management, and we'll discuss this more as we go along. So a little bit on the history of silver diamine fluoride. Its research originally began in the 1960s, led by doctors Nishino and Yagama in Japan. And this ultimately led to the first product being released in 1970 in Japan. Following its approval there, products were released in Australia, Argentina, and Brazil. And then the original approval in the US only began in 2014, so less than a decade ago. The approval was for dental hypersensitivity, like other fluorides, but in 2016, the FDA granted the designation of breakthrough therapy to Advantage Arrest. And this breakthrough therapy actually allows for the expedition of development and review of drugs that address serious medical needs. So given that this would address caries arrest, the FDA is watching its progress very closely since caries treatment is not currently an on-label use. It's approved for dental hypersensitivity, but the off-label use is for caries arrest. So before we talk about some of the advantages of it, we do want to talk about the bad news before the good, because there is one major disadvantage. Specifically, while there are all these advantages to silver diamine fluoride, sometimes seen as SDF, there is this one major disadvantage, which is staining. Now, the staining happens to only take place on carious lesions. Silver diamine fluoride is a clear liquid, but when it is placed on it after this curing takes place, as you can see, these caries turn to a very necrotic looking black. They do harden the cavity, but the cavity still exists there. And obviously, as aesthetics are a major concern in dentistry, this is something that it's really vital that we take into consideration with our patients or our patients' parents or guardians, that we want to have a very thorough informed consent. So photos like these should be shown to patients so that way they are able to make a decision on whether or not this is appropriate treatment for them. Now, one thing to note is that it does not stain sound enamel or sound dentin. So it's a traditionally clear liquid. It would be placed, if it was placed on a tooth without any cavity, it would not or should not stain the teeth. Now, it is contraindicated in patients with a history of silver allergy because it can cause mucositis or gingivitis. Here are some images of posterior decay or carious lesions. We have obviously some pretty significant decay down on the lower left of our image here. And we have interproximal decay down on the lower right. You can see obviously that one's a lot harder to see. But again, these are just intended to be images that you as a practitioner would want to have an idea and be able to discuss thoroughly, so that you are providing an extremely thorough informed consent to your patient prior to proceeding with treatment. Even doctors who pioneered SDF in Japan noted that because of the stain, application should be confined to posterior teeth. Now, There are some other disadvantages. Some of that is metallic taste. Even though this is short-lived, it is a possibility that a patient might complain that it has altered their taste. There can be tissue staining, similar to an amalgam tattoo, although this seems to be confined to when SDF is placed subgingivally. There can be tissue irritation or sloughing. So some practitioners like to apply a like petroleum jelly to some of these tissues to prevent that, or they like to place it with a dental dam. But usually this tissue sloughing or irritation is short-lived. It's not usually seen within a few days, and it is completely resolved around about a week post-treatment. Now, I mentioned previously that it does not stain mature enamel or dentin, and that is true. However, it can stain hypomineralized or immature enamel. So this image here on the left side is obviously central incisors that were in the process of erupting when SDF was applied. Even though it did not stain them black because they were not carious, it did still stain them. So obviously that is still an aesthetic concern for the patient and or patient parents. Now, SDF is not a one size fits all for each carious lesion. So it really can't be applied to teeth that are showing evidence of pulpal involvement. It really needs to be confined to lesions that are in the outer or middle third of dentin. So if a patient, if it's suspected that the inner third of the dentin or the pulp has been breached by the infection, really that's not an ideal tooth or an ideal candidate for SDF placement. Or maybe the patient is an ideal candidate, but maybe not that specific tooth. Now, there are a lot of advantages. The first is that it reduces or eliminates dental hypersensitivity immediately. The second is it is a non-surgical option for caries arrest, meaning there is no drilling, there's no excavation needed of the decay, there's no anesthesia that's needed. So this can be a wonderful treatment for special needs populations or for pediatrics, in that it's pretty immediate. It's an immediate assistance to that patient. It's also really easy to apply. So dental auxiliaries like assistants or hygienists, depending on state scope of practice, may be able to utilize this either currently or in the future. And then it can be used for caries prevention without staining the teeth. And it can also expand access of care. So in combination with a dental auxiliary who can place SDF, if there are, for example, hygienists who are in alternative practice settings where they're going to either a home setting or some kind of community center living, it might be that this could be applied until that patient is able to have dental work completed at a dental facility, or to have a dentist complete work there with them. Now, some other things that are worth noting as an advantage, there is no prophy or cleaning that's needed before you would actually apply this SDF. And as mentioned previously, there's no drilling that's needed. So there's no excavation of the necrotic tissue. It will actually, when you are applying the SDF, anything that is soft from decay will actually harden after the application. And then ideally, if patients are then interested, restorations can be completed at a later date. There were 2 studies. I mentioned that this can be used for caries prevention. 2 studies, one of children and one of elderly, that found yearly applications of SDF showed better prevention of incidence of caries than quarterly applications of a sodium fluoride varnish. And a third similar study found no difference between the 2 fluorides, which really suggests that SDF is comparable in effectiveness to other fluoride varnishes that are currently being used on the market. It's also extremely cost effective, and we'll get on into this a little bit later in a slide or two. And then because dental auxiliaries can potentially place this now based on scope of practice, or in the future based on scope of practice, a private practice dental office who's really fiscally concerned might be interested in utilizing it instead of sealants. Sealants ultimately in the current research are showing to be more effective than SDF. However, it takes less time to apply SDF than it does to place sealants. The materials needed for SDF to be placed is cheaper than the materials needed for sealants. And because it could be placed by dental auxiliaries, say an assistant versus a hygienist, the amount of time and the expertise of the individual placing it could result in terms of payment for that individual, it comes out to where that individual is typically it takes less time and ultimately comes down to the money that the dental office would be paying the individual to do that. So it takes less time to apply. It can be applied by someone who is quote unquote less skilled. So a dental office who's interested in trying to keep their bottom line low and keep production up would be very interested in utilizing this. Now, what equipment's needed? This is a wonderful news for offices as well as for anyone who might be out practicing in an alternative setting. There's really not anything that's not already readily available in a dental clinic, and all of these things are fairly inexpensive to maintain stock of. All of this would be things that are already on hand for any office already in practice. And what's the process to apply? So the first is that you would remove any loose debris, like anything food that might be trapped. You would isolate the tooth using their cotton rolls or a rubber dam. You would dry the lesion, and then you would apply the SDF. After that, you would dry the area again, isolate it for roughly 3 minutes. And then if it's a deeper lesion or a larger lesion, then you would potentially apply sodium fluoride varnish, though that's not recommended universally. That's just recommended to avoid saliva washing away any SDF, is to keep it in contact with the carious lesion as long as possible. So it's not required, but it is an optional practice. Now on to product pricing. As mentioned previously, it's very inexpensive. These two products that are currently on the market by Elevate Oral Care, Advantage or Rest was the very first product that was approved in 2014 and is still maintained on the market now within the US. As you can see, both of these are under $200 a piece. And then of course, there's a discount if you purchase multiple at one time. Now, these these look obviously very small, but one drop treats 5 locations or 5 sites intraorally. And so even this small bottle down here on the lower right has roughly 250 drops in it. So if you think about what that comes out to, it's over 1,000 applications for just this one bottle that's under $200. So ultimately, it comes out to treatment for one site's less than $1 a piece, just based on the price and based on how far that one little bottle will get you. So very, very economical for dental offices. Now we're going to go on and talk a little bit about the efficacy next.
So for the efficacy in silver diamine fluoride, it is a non-invasive and inexpensive antimicrobial liquid that is used to decrease sensitivity and to treat carious lesions that may be too extensive to restore. It contains silver ions that act as bactericidal and antimicrobial agents in these lesions. In the process, it denatures the protein and exterminates bacterial membrane and prevents replication of the DNA. The fluoride ions contained in SDF are vital in the creation of fluoroapatite, which is a stronger acid-resistant enamel that mitigates the demineralization of the tooth structure. Studies have shown that the application of SDF to lingual, facial, and occlusal surfaces are to be more effective in arresting these carious lesions. In the application of SDF to interproximal surfaces, it is being increasingly studied and it is in the process of research. Although the single use of SDF has not been efficient for sustained impacts, semi-annual and annual reapplications have demonstrated high success. In the effectiveness in young children, studies have shown that this treatment is a promising model for managing dental caries among these children and young people, as well as individuals with special needs. This treatment heightens biofilm pH and decreases tooth demineralization. It further has antimicrobial reaction against all cariogenic bacterium. Undergoing semi-annual SDF applications have demonstrated increased fluoride uptake in comparison to fluoride varnish. In the accomplishments of SDF, as we have spoken before, it has been very effective in compared to other preventative measures. Several respondents have agreed that this treatment would be within the scope of practice for a registered dental hygienist. It provides a great alternative and is less expensive. It is time efficient and can be used without local anesthesia, which helps children for dental anxiety. Research and the use of SDF fulfilled the World Health Organization developmental goals for health. Besides, it contributes to the present inequities in global oral health and provides a friendly treatment for those in pediatric care. We thank you for joining us in our presentation regarding silver diamond fluoride, and we hope this information helps you feel confident in referring patients to this treatment.